Welcome to another knee moment from Knee Fit in 5 and MSM Products. My name is Dr. Matt Lawless.
And I'm Scott Johnson with Physical Therapy. Dr. Lawless, I wanted to ask you today because it's a common question that I have, and it involves ice after a knee replacement.
Oh, that's interesting you bring that up because I get a lot of questions about ice. Does ice help? When to use it, when not to use it. And I routinely use it. I use it after all surgeries, and my direction to use it is to put a barrier between the skin and the ice.
So let me just stop you there. So a barrier. A lot of people want to know, what type of a thickness. Are we talking like the thickness of a pillowcase, or are we talking a thick towel?
So washcloth is what I usually suggest. So that's kind of in between them, but probably any of those, just as long as the coolness gets through. If you use something thicker, it might take a little bit longer for the ice to penetrate through the towel and then eventually chill the surface of the knee. Okay. But there's a reference we have in Knee Fit in 5 that talks about icing, and ice is probably best used almost continuously. So the benefit of ice in helping pain, so the pain is a little bit less in people that do ice continually. So I ask them to ice as much as they can. So they sleep with the ice on, they lay around during the day with the ice on. They take it off obviously to get to and from the bathroom or to do their knee exercises, but I pretty much shoot for as much ice as they can easily do.
So we make the recommendation in Knee Fit in 5 for people after a total knee replacement. For the first 2 weeks, they really need to focus on controlling their swelling, and ice is a big component of that. And so what we ask them to do is when they're not ambulating to the bathroom or getting from point A to point B around the house or doing their exercises, their leg is elevated, it's iced, and it's compressed. And so that's for a total of about 2 weeks. And then after that, we usually recommend as needed. If they go out and do something, or their knee swells up because they've increased their activity, then they need to go back to the basics and get it elevated, ice, and compressed, just so that they don't lose their range of motion in their knee.
Yes, and a lot of people, even without surgery, the people that see me beforehand that have knee arthritis and they're having soreness before they go to bed, I suggest, ice before you go to bed. Put the ice on as long as you can tolerate it before. If you have an hour, you can read for an hour, watch TV for an hour. Well, put the barrier down, put the ice on your knee, and sit there with the ice on it. And they seem to get good relief from it.
Great. That's great advice. I think that's going to be helpful for the patients. Thank you.
Yeah. And I guess the biggest thing to say is that there's really no downside to it. As long as there's a barrier, then the ice should help with the soreness.
Okay, great. Thank you.